estrogen dominance is a huge issue, and I think every year I'm in practice, I see it more commonly. And today I wanted to go over, first of all, the symptoms of high estrogen or estrogen dominance, which are things like fibrocystic breast disease or dense breast tissue, weight gain, migraine headaches, PMS, heavy bleeding or menorrhagia, anovulation or irregular menstrual cycles, endometriosis, uterine fibroids, and things like breast cancer and endometrial cancer. And I think that I know the best way to really treat these things is to always get to the root cause of it. So today I wanted to secondly go over the main root causes and help you grasp an understanding for what are the areas that maybe you should be tested in or talk to your provider about, or what are the things that you should be addressing if this is a concern for estrogen dominance. First of all, perimenopause. It's very common to have estrogen dominance during perimenopause, and think of this as just an imbalance between estrogen and progesterone. So it can happen in presence of normal progesterone, you just have a lot of estrogen, or it can happen because you have a low progesterone, and so just the ratio of progesterone to estrogen is off. And those are treated two different ways most commonly, okay? The second way that we can have high estrogen is that is taking exogenous estrogen, like an estrogen cream, an estrogen patch, without progesterone or without enough progesterone. We just have an imbalance. And interestingly enough, estrogen taking exogenously actually can raise cortisol, and a higher cortisol, even in the presence of just stress that we all go through life, then it actually can block the progesterone receptors, and over time, the adrenals, which make cortisol, can actually take from the precursor hormone to progesterone called pregnenolone and then cause an imbalance. So that can kind of happen a couple different ways. Next, xenoestrogens, which would be things that we would pick up from plastic water bottles, is a huge culprit. So I'm always telling patients to drink out of glass instead of plastic or aluminum or anything but plastic, okay? So like, plastic water bottles, storing your food in plastic containers, PVC products can have this, our facial skin creams, herbicides, pesticides, those kind of things, we can pick up these xenoestrogens and not detoxify correctly and just create this extra estrogen. Fourth, obesity or weight gain. And this can be kind of like one of those hamster wheel issues, because if you're estrogen dominant, you'll have a hard time losing weight. But when insulin is staying high because of our nutrition or because we're overweight, then insulin actually also increases estrogen. So a big part of what I teach patients is lowering the insulin, managing nutrition, and getting some of that weight off, and over time things naturally will kick back into gear, even if I've got to use medications and supplements for a period of time. Nutrition, let's lead right into that. Number 5, there's a ton of hormones in our meat products in particular. It's best to eat grass-fed when possible, and avoid any kind of protein that would have antibiotics and hormones. And processed carbs, refined sugars, those kind of things. We're going to make our insulin higher, and then here we are again in the hamster wheel. So I usually recommend kind of like a modified paleo type of diet. A lot of vegetable intake, a lot of fiber helps us detoxify from these extra estrogens and balance all of these hormones and balance our insulin. Next is nutrients. You actually need B12, folate, magnesium, and zinc to properly metabolize hormone, to detoxify, and create balance with estrogen. And number 7 is toxins in the body. It kind of goes back into the xenoestrogen mode, but this is actually beyond that. A lot of people have mercury toxicity, and that can be something that can be checked if you're just not getting results, or maybe you have other symptoms that we're thinking like our red flags are going off in the office of you could have a toxicity. We excrete our hormones and we detoxify through the liver, the kidneys, our feces, so having bowel movements, and through our urine. So all of those processes and even our gut needs to be healthy. If we don't have good gut bacteria and certain enzymes like calcium deglucarate, we have a hard time detoxifying from estrogens that we either make or pick up environmentally. So those are 7 causes of estrogen dominance. I hope it gives you some insight, some things to be thinking of and asking your provider about in terms of testing and treating your symptoms and your imbalance. Have a blessed day.